Hello guys, I am Sudarshan. I am third year MBBS student at VDGMC Latur, and today's topic is ACE inhibitors. It means angiotensin converting enzyme inhibitors. This is very important topic in CVS pharmacology, and I have covered this topic in only 3 pages. And I will also give you tricks to remember all the topics which are all the questions that are asked in your exam regarding this topic. The questions may be the mechanism of action of ACE inhibitors, what are ACE inhibitors, then classification, that is what are the drugs, and then pharmacokinetics, therapeutic uses and adverse effects. Okay, so we will go one by one. First of all, what are ACE inhibitors? These are first line antihypertensive drugs. So these are basically antihypertensive drugs. Okay, then next is mechanism of action. Angiotensin 1 is converted to angiotensin 2 in presence of the enzyme angiotensin converting enzyme. ACE means angiotensin converting enzyme. And angiotensin 2 has various effects on the body, like constriction of blood vessels, increases aldosterone production, and increases sympathetic activity, which leads to increase in BP. But ACE inhibitors inhibit this enzyme, angiotensin converting enzyme, which leads to decreased production of angiotensin 2, which ultimately leads to dilation of blood vessels and decreased peripheral resistance, and which ultimately causes decrease in blood pressure. Then second effect is decreased aldosterone production, which leads to decreased sodium and water retention, which ultimately leads to decreased blood pressure. And last effect is decrease in sympathetic activity, which ultimately leads to decrease in blood pressure. Other effects that ACE inhibitors causes is they inhibit degradation of bradykinin by ACE enzyme. Okay, so that's why there is increase in levels of bradykinin, which is a potent vasodilator. So it has various vasodilating effects on the body. They stimulate the synthesis of vasodilating prostaglandins through bradykinin. So this bradykinin produces various vasodilating prostaglandins. Then next is classification. What are the drugs? Enumerate drugs, ACE inhibitors. The trick is replicase. So R for ramipril, E for enalapril, P for perindopril, L for lisinopril, I for imidapril, and C for captopril, and this ACE for ACE inhibitors. So very easy to remember trick is replicase. The next point is pharmacokinetics. So ACE inhibitors are usually given orally. There are 70% of the drug is given orally, and in hypertensive emergency condition, enalapril is given intravenously also. Okay, and presence of food decreases bioavailability of ACE inhibitors. Half-life is around 2 hours, but the action lasts for 6 to 12 hours. Okay, now we will learn the next point, which is therapeutic uses of ACE inhibitors. So let me adjust this. Okay, therapeutic uses. The trick to remember therapeutic uses is pure HD mics. Okay, pure HD mics. Pure for prophylaxis in high cardiovascular risk patients. CV means cardiovascular risk patients. Okay, then in this condition, the ramipril reduces cardiac death and myocardial infarction or stroke by 22% over a period of 4.5 years. This is seen in one study. Okay, and there is decrease in heart failure and diabetes. HF means heart failure. The next is H for hypertension. ACE inhibitors are first line drugs in all grades of hypertension. Nowadays, ARBs, that is angiotensin receptor blockers, are now surpassed the use of ACE inhibitors in case of hypertension. Okay, I have covered this topic in a separate video. ARBs, angiotensin receptor blockers. Okay, the next point is advantages of using ACE inhibitors in case of hypertension. First is they decrease type 2 diabetes mellitus condition. Then renal blood flow is well maintained. There is no chances of hyperuricemia, no rebound hypertension on withdrawal, and decreased in serious morbidity. And there is no change in lipid profile. This is another advantage. And D for diabetic nephropathy. Prolonged AC inhibitors therapy leads to prevention or delaying end-stage renal disease in type 1 and type 2 diabetes mellitus. Okay, this is effective in hypertensive and normotensive patient also. HTN means hypertensive. It is effective in hypertensive and normotensive patients also. Next is MI. This MI for myocardial infarction. AC inhibitors should be started within 24 hours in this condition, myocardial infarction. They have both short-term and long-term improvement in survival, and they also decreased reinfarction rate. Next use is C for CHF, congestive heart failure. In this case, both arteriolar and venodilation in the CHF patient is seen through AC inhibitor use. Then they decrease afterload as well as preload on heart. They improve all the hemodynamic parameters, and they increase the stroke volume and cardiac output, and they decrease the heart rate. There is no direct effect on myocardium. Okay, and then S for scleroderma crisis. In this case, they produce dramatic improvement, and they are life-saving drugs in this condition, scleroderma crisis, because increase in BP, there is marked raise in BP, blood pressure, and deterioration of renal function in the scleroderma crisis is mediated by angiotensin 2, and AC inhibitors decrease the production of angiotensin 2. That's why they produce dramatic improvement, and they are life-saving in this condition. Now lastly, we will learn the adverse effects of these drugs. Okay, this is very important. Adverse effects of AC inhibitors, frequently asked in your exams. So let me adjust this first. So the trick to remember the adverse effect is captopril. One of this drug is captopril, so very easy to remember trick, captopril. C for cough, it is dry cough. AC inhibitors increases bradykinin levels in the lungs, and which ultimately leads to cough. A for angioedema. Angioedema means swelling in throat, nose, lips, mouth, larynx and glottis. If there is airway obstruction, in case of angioedema, there is airway obstruction sometimes. In this case, give adrenaline, glucocorticoids and antihistamines for the airway obstruction. P for proteinuria. The drug should be discontinued for this adverse effect, and it rarely occurs, proteinuria. Okay. Next adverse effect is T for teratogenic effect, like growth retardation, fetal hypotension, renal failure and neonatal death. That's why AC inhibitors are contraindicated in pregnancy. CI means contraindication. Okay, they are contraindicated in pregnancy. Then O for hypotension, this O. Okay, hypotension, AC inhibitor causes hypotension in CHF patient, congestive heart failure patients. Okay. P for neutropenia. P, neutropenia, this is rare condition that occurs due to AC inhibitors. Then R for rashes, I for itching, L for loss of taste sensation, which is also called as dysgeusia. Okay. And last adverse effect, which I didn't mention in the trick, is hyperkalemia. This occurs in renal insufficiency patient, or when they are combined with potassium sparing agents. It causes hyperkalemia. So I have covered all these topics in just 3 pages and this short video. So thank you for watching. If you like this video, do subscribe to my channel and share this video to your friends so that